So welcome this evening, and we really want to welcome you. And as I say, thank you so much for joining us during your Easter break. We know that there were lots of people who couldn't join us, but we're recording this and you will be able to, others will be able to watch it. But we're really excited to have Melanne with us tonight. And we're going to be talking about such an important topic, which is mental health in children's mental health, and looking at how we can support children in this area and understanding more about it. And we were quite surprised because we looked up some data and we found in 2017, so this is a few years ago, it said in the Royal College of Pediatrics and Child Health that 10% of children have a diagnosed mental health condition. Now, if that's diagnosed, think how many more children have mental health conditions. And that was 2017 before we had
pre-pandemic, pre-lockdowns.
So we're talking about a large population of children. And so it's really important we understand more. And we're really excited to have Melanne with us, who I have known Melanne for many years indeed. And she is an international speaker and such a wonderful person and so highly respected in her field and beyond her field. So Melanne, we're so pleased that you are joining us tonight. Thank you so much. And I think it'd be great if you could just tell us a little bit about yourself.
All right, well, thank you very much for including me in this topic. I'm pretty passionate about people correctly understanding what is involved in this topic. Introducing myself, I'm the director and owner of a therapy practice called Maximum Potential, which is flagship is based here in London, a number of clinics, freestanding clinics and clinics in schools. And then we have clinics in a number of countries abroad. Yes, I do lecture. As Jackie said, my focus when I lecture is heavily on educators, mainly because, as I was just explaining a few minutes ago to these lovely ladies, they are my front line or our front line. No one spends more time with children than educators. And it's important to me that they understand and are able to identify children at risk, understand what these children are telling them through their behavior. By the way, just a quick comment on the children that are diagnosed with mental health issues. I think that needs to, and we will discuss that tonight, be looked into a bit further, because very often the diagnosis is not correct. The diagnosis is just of the top of the pyramid, if you will, of the behavior we're seeing, but not the underlying cause for the behavior. And the treatment should be at the underlying issue, not the end product.
Absolutely.
So,
absolutely, Mel.
Yeah. So if this comes across for children you work with or a child of your own, we're going to talk to you tonight about asking further questions. And I also lecture to parents and to therapists and doctors. I actually wear two hats. I'm a medical doctor, a pediatric neurologist, and I'm an occupational therapist.
Amazing.
Amazing. And you're here with us tonight. Quick, let's ask some questions.
Yes. Launch in with a question.
Well, before we do, it's just be sort of interesting just to sort of think about the signs of mental health.
Yes, that's
so
true.
I mean, we've come up with some, haven't we? And we feel that one of them is like changes in behavior. And like using that word behavior, Melanne, which you were saying, which is actually, there's
communication,
so much underlying stuff going on underneath. So, maybe not wanting to go to school or to the setting or to people's houses like they did before, like clingy kind of behavior, not wanting to do things they normally want to do, and withdrawing from social situations, or not being able to sleep well. So Melanne, what do you think, launching in here, what do you think are the factors from your perspective that are impacting on children's mental health, particularly right now at this moment?
Well, first of all, almost everything you just listed we can tie back into sensory systems.
Yeah.
Underlying sensory systems, which I know is a detailed discussion for another time, but that get stuck in our development. Okay. And children develop all kinds of compensatory strategies because they got stuck. A lot of the behaviors we see are compensatory strategies. The child that has rather sophisticated avoidance techniques because he's aware that he's struggling often becomes labeled oppositional.
Yeah.
And, diagnosed. And that's the oppositional behavior is a protective mechanism because he's struggling.
Yeah.
And not being able to sleep is a direct vestibular issue. It has to do with self-regulation, which, by the way, is the crux of behavior. If you're having difficulty navigating emotional responses, if you're struggling with all of the self-regulation that is involved all the way down to focus and attention, you're not going to be functional. Your performance is going to be affected. Unfortunately, in the professional world, a little bit of education goes a long way, and people go around with their little stamp diagnosing everybody and treating the alleged diagnosis instead of, as we said a minute ago, the underlying symptom. But related to the pandemic, the isolation that we're seeing, we've got children that are now, some children are coming back into school and they're in year 1, but they haven't even really been in school yet. And all of a sudden now they're having to line up. They're having to eat with lots of children around them. They're having to take turns. A child might take the toy that they want.
Yeah.
They haven't learned the sharing mechanisms. You're getting a lot of behaviors that are coming out. And a lot of the educators that I speak to are just overwhelmed because they're seeing this massive increase in children that are struggling with, and I'm going to call it the emotional regulation piece.
Yeah.
Never mind the socialization piece. That's dropped off. Some little ones haven't learned it. Others are out of practice. Then the stress of seeing parents lose jobs, the panic that comes out in the house, because they're all locked in the one house or several rooms together, the relationships breaking down. Children don't miss a minute of that.
They don't, do they?
No. And they're carrying that on top of everything else on their little shoulders.
Yeah.
And then they're being asked to perform in a rather regulated way in a school setting. And I'm coming back to the word overwhelmed. Which is key. And I think one of the biggest messages that's going out to educators right now in what they're calling recovery plans is to step back and take a breath.
Yeah.
We're not going to fix this quickly.
Yeah.
There are a lot of fears out there that we're going to be dealing with this and the fallout from this for years, depending on how we handle it. Okay. I think that when it comes to dealing with mental health, the emotional stability, the regaining a sense of, depending on which country you're from, normalcy or normalcy is really where everybody needs to start to go. Yeah. The push has been, we have to catch up with academics. We have to catch up with academics. We've lost a year. We've lost a year and a half. Actually, we need to catch up with the emotional mental health aspect of it first. There's a quote I'm going to give you, and I was talking about this before we went on, and I use this when I lecture a lot. When feelings aren't managed or regulated, thinking is impaired, and when the brain is dealing with unregulated emotions, it can't learn. So we really do have to deal with emotional regulation.
Yeah, absolutely.
I love that, Melanne. I love what you say about step back and take a breath. And I think this is something that we've talked about a lot in this, particularly for younger children. Now, I know obviously it's difficult with older children with exams and things, but for younger children, particularly with socialization and play and social communication, they need time. And there is no sort of pushing them to try and catch up,
Yeah.
but actually giving children time. They'll get through this, but we need to give them lots of understanding and grace and time.
Yeah.
And gradual
validation that what they're feeling. We've got kids saying, I'm so angry, but I don't know why I'm angry.
Yeah.
And validating that it's okay to be angry, and not understanding it. We feel that way too, and working through it. And some of the social dilemmas that are going on in classrooms, like I'm going to go back to the little one that someone takes a toy away and he just starts hitting the child. Is real-time correction, real-time role playing. Versus sending a child to the office or putting him in a timeout chair or sending him outside of the room with an aide. He's not going to learn from that. So we're actually going to have to ask educators, caregivers, because that's a whole second part, to do this a little bit differently. And there's also a big push on educating teachers on how to handle this. So instead of the new math technique that's coming out, it's emotional regulation. And how to help your children with this.
I think it is so important to be looking at these things, and we sort of see them as extracurricular, but they're not. They're foundational, aren't they?
Core.
They're core. And emotional regulation is something, even as adults, I sometimes struggle with emotional regulation, and we all struggle. But for children, it's so important. And I know we're going off the questions a little bit.
No, it's great. I love going off the questions.
One of the things that you mentioned there is about that side. And one of the things we talk about a lot is demonstrating calm and being, children will often look to us. And you were talking about parents who lost jobs and things. Children will often look to us, won't they? Of how should I be feeling in this? I don't understand what's going on, but my mother's anxious or whatever. And that emotional contagion and picking those cues up, it's so important, even if we don't feel calm, that we can demonstrate calm to children to help them regulate.
Absolutely.
Also, speaking of your own regulation, and I've just had a little presentation on this with a group of therapists who are seeing more and more children act out in therapy sessions. Well, again, this is all a side effect of the pandemic and the acting out, and this is a safe place for them to do it. But what we have to do more than ever is be very careful to monitor our reactions. So pre-pandemic, we always want to monitor our reactions, but talk about the act of being calm and aware is when a child would hit you purposely. You might deal with that a little bit differently, where now you need to almost not react, recognize what happened and say, let's talk about what were you feeling when that happened. Now, depending on the age, but we do this with 3 and 4 year olds. And the little comments we're getting is, well, I'm scared. Or I don't want you to see that I can't do it. So if I hit you, you're going to get mad at me. And then I don't have to do the activity because I'm in trouble then. That was the most amazing response we got from a 5-year-old.
Wow.
So
that's amazing.
There's a whole new level that I think anybody who works in pediatrics needs to offer to support their staff as well as their parents. And I know many practices, and this is not an ad, but we're looking at offering some parent groups on some of this, that they need to learn to understand what children are telling you. And then what you can do to help them, because children don't miss a beat.
No, I agree.
They've been sitting back absorbing all this while we've all been running around going and feeling helpless because they have no control over what happens to them. That's another thing that's coming out. So in a therapy session, in a classroom, we're actually saying, tell us what you want to do today. Let's design it. So we're going back to child-led activities.
Yeah, absolutely. I love that. Because Helen's written a book about building resilience in practitioners, haven't you? Which is, this is something you're very strong in you. But just going back to something you said earlier, Helen, when we were talking, is you said that sometimes in the nursery you would just go and sit, wouldn't you?
Yes.
On the cushions, and be silent and let children come up and talk to you about how they were feeling.
You know, there's some mornings, it's so funny being in early years, because some days there's no rhyme or reason. It's just not a great day. And nobody really knows why. It just
for the child or for you?
For the child. And then so I would just go and sit, you know, in their space on the cushion somewhere, and children would just come to me. And we'd read a book. We're like, what are we going to do? What should we do? And we'd read a book, or we'd go and play with something. But it was really powerful because it drew children, and they just knew that they could come and they could talk. They could. I wasn't going to dominate. They were allowed to just sort of share things that they were feeling, and there was no. Like, you know, you were saying a child might hit because they feel they've got to perform something they can't do, and just removing that kind of that sort of feeling I've got to perform. And it's really, really powerful. And I think, you know, it was so lovely as well, reading or whatever it was with these children, and just having a very healing time on these mornings that for no rhyme nor reason just weren't working for these particular children.
And I think beyond practitioners, I think it's really lovely for parents to have special times with children. And I know it's not so easy. I mean, my daughter's got 4 children. And so how you manage to have individual special time, but children do need their own time. And in a one-to-one situation, where you can turn off your phone and you are wholeheartedly listening to the child and showing them you're listening, and there's no rush, and this is your special time. And we really encourage parents to try where they can to do this, and particularly if you've got a child that's feeling anxious at the moment, to go into that, you know, that they have their own space, their own moment with you, where they can say whatever they like. So for teachers and for parents, that's also really important.
I think it's so important. And you were talking about validation, just really being with someone else, and an adult being with you as a child is such a validation that I'm worth being with, and for this person to give me their time. And I think there's nothing more powerful than that. And switching off phones. Oh my goodness. Don't turn them on in the first place. I'm the worst. I know. Do you know,
we've got our phones on either side.
I know. I had quite a lot of hours on my phone, and you know, I think it's just so important to turn it all off, be with your child, and just give them that time. And it's just so powerful.
The other thing, I'm sorry to interrupt, I have to throw in, is not trying to fix it.
Yes.
One of the biggest mistakes, and when I watch parent-child interactions, and a child who's saying, you know, I'm anxious, or I'm really worried, or the parent will often say, oh, there's no need to feel that way. Or instead of, which completely, what's the word I'm looking for? Not devaluates, because I don't know if that's
it devalues how they
see the little face fall. And it's kind of, so it's actually recognizing it and saying that must be a really uncomfortable feeling. Let's figure out why you have it, you know, but it's not a fix. You know,
that's so important. It's like we can so easily say it's all going to be fine, it's all okay, but that doesn't help the child, does it at all? Because we need to be able to say, I understand.
I think that's auto hypnosis on the parents' part. But it is. So I just wanted to throw that out. That's another message to parents. You don't have to fix it, but you do have to validate it.
Exactly.
Let them know that must be uncomfortable, and I feel that way too sometimes.
You know,
I can share strategies when I feel that way. This is what I do. You know, what do you do, or what have you ever tried?
I think that's so good. And just that being with them and that calmness. And you were talking about, you know, when you're stressed, you know, you can't think, and when you can't think, you can't learn. And when you're stressed, you can't think about maybe the positive things that might come from whatever this is. And so just being in that quiet space with your parent or whoever it is, your teacher, that your brain calms down and you're able to think with your parent or whoever it is. Co-regulation, our favorite.
We love co-regulation.
I love that word. Yep.
Yeah, we just love that. And then of course, then you can, any strategies can be then approached. But I agree, and it's not about fixing or quick fixes or any fixing. It's just sitting in that uncomfortable place with them and supporting, holding the hand. That's so, it's huge.
You know, the talking about giving children time to, you know, come out of this difficult situation. And one of the things, Melanne, that we talk about a lot, and this is particularly in relation to attachment, is, you know, I think one of the things that I've noticed is that a lot of children have become a lot more clingy at this time and not wanting to separate. You mentioned they don't want to go to social events and things. And that I love, we say regularly, you know, that children need to be dependent before they can be independent. And you need to give them time to be dependent so that they can become independent. And it's about building that confidence again. And if you're listening and you've got a child that has been independent, has gone back into that place of being dependent again, just allowing them to do that and not feeling you need to push them away, or you need, that is something showing that they actually need that security. They need that warm, nurturing relationship, trusting relationship. They need more time with you. So it's difficult to manage. And it means for parents staying at play dates or staying at parties where you wouldn't, or things like that. But just where you can, understanding that actually dependency is sometimes really important in young children, and allow them to be that before you're expecting them to be independent.
And older children as well.
And older children.
Yeah. Yes. I mean, it even applies to young adults. You know, you might want to go home and just cry.
And spend some time at home with your trusted adult. Absolutely.
Exactly.
Well, I don't want to bring out a difficult word, but it is very typical of trauma.
Yes.
Okay.
And the pandemic has been a trauma for us all.
Yes.
Something that we never would have envisioned ever happening.
Yes.
And the children, I think we're finding, have been traumatized the most.
Yes.
So, and a typical thing of trauma is, and another word we don't like to use is regression, but we've seen quite a bit of regression, and it's okay, because it's just them going back, needing to be dependent.
Yes.
You know, from a skill standpoint, which I know we're not talking about, you know, skills tonight, meaning gross motor skills. It's just, you know, they haven't used them.
Yeah.
It will all come back. You know, it's all going to be fine. Yeah. But it is really, I'm going back to my word. I need you to stand back and take a breath. I need you to breathe.
I love it. Yeah.
Yeah. And so understand what the children are telling you. That's another one of my favorite, you know, things. And then from there, what you need to do or give or provide.
Yeah, that's so good. Now we've got some more questions, but I've forgotten to say, if anybody has got a question, they can put it in the chat. So do that. Oh, and I think we've got some. Sorry, we'll have a look at those. Okay, we've got some questions already. Maybe if we ask Melanne a couple more of our questions, and then should we go to some of these? Great. Yes, we'll come to those.
Yeah.
So do you want to do that?
Yes.
One?
So Melanne, we know now children with sensory processing needs can, you know, they can often find it difficult, can they, to interpret and label how they're feeling, whether frustrated or scared or whatever it is. Why is this, and what can be done about it? And do they find it difficult? Is that?
Well, you've got to be careful, because one of the reasons working in pediatrics is never boring, as every child is a completely different cocktail, meaning every adult as well, of issues where they're proficient and the development proceeded normally, or areas where they got stuck and either compensatory strategies are not working for them, or they're just not being functional. Emotional regulation, self-regulation, all of which is this big umbrella that involves the interpretation of a lot of what you're talking about, falls under a system called the vestibular system.
Yeah.
And the vestibular system, just really quickly, is in the inner ear. There's 3 semicircular canals with hairs, crystals, and fluid. It's developed through movement, and movement in multiple planes. And the more sedentary a child has been or becomes, of course, you get this system shuts down. And the pandemic was a rather sedentary time for a lot of people when we were in serious lockdown. But children with sensory processing disorders, even pre-pandemic and moving forward post, the first thing I look at when I see in checklists, or I hear from teachers or parents, that there's emotional self-regulation issues. And that also includes focus and attention, internal distractibility, all of that. Sleep disorders, the first thing I look at is vestibular system.
Interesting.
Wow.
Yeah.
And the first message to parents is that this is not intentional. This is not a child being a naughty child on purpose. He can't or she can't help it. The system that is supposed to help them with this, supposed to support them, got stuck. It's not online. It's not doing its job.
Yeah,
that's so good, and that's so important to know.
That's amazing. And as you say, so many children have been so sedentary.
Yeah.
Can't help. Oh my goodness. So that really is that's a huge issue, isn't it?
Yep.
I would love to ask this one.
Do you want to do this one?
Katie Bray. So Katie's written 2 things. Oh gosh, there's something else underneath there as well.
Yeah.
But anyway, so she's a teacher.
We got lots then.
With Thrive training.
Do you know Thrive, Melanne?
Great.
And so supporting self-regulation. She says, I believe in it with every fibre of my being. Can you expand on how you can communicate with and she quotes, children acting out in a safe place, and the need to monitor our reactions so I can explain it better to other teachers and teaching assistants in my setting, please. And she goes on to say that, because we spoke about this and you said there's no need to fix it, and co-regulation and this, but could you?
Well, first of all, there's many ways that children act out. So does she want to throw us a quick example, or do you want me to use an example of acting out?
You want to use an example, though?
Okay, so if you've got a child acting out in a class, age range?
So she says, say 8.
So, 8, well, that's rather, okay. So you've got an 8-year-old that's acting out in the classroom. He's either being distracting to other children because he's not doing his work. So he's, flipping his pencil. He may be rocking back in his chair. He may get up and walk around the room. First thing you need to understand, the first thing you have to ask yourself is, why is he doing this?
Mm-hmm.
What is he seeking from a support standpoint that he's not getting by sitting most likely in a static desk at a static chair? So he's seeking movement. He's rocking. He's getting up and moving around. Why is he seeking movement? Because when he sits in a static situation, the vestibular system shuts down. And if that system's not up and running, by moving, you move the fluid in those canals I was just talking about, which helps activate that system, which helps him to self-regulate, focus and attend, and get on with his work. So if that system was working for him, he wouldn't be acting out. Because he'd be doing his work. But because he's not able to get himself organized, he's not able to get himself focused, regulated, so that he can get on with the task, he's going to act out. All right, so that's a simple example. What you can't do is do something punitive.
Yeah.
What you might want to do is remove him so he's not distracting the other children. This is where we spend a lot of time training classroom aides or assistant teachers. Everybody calls these lovely people something different, but we spend a lot of time training them on classroom strategies because the teacher's teaching.
Yeah.
So she might want to remove that child from the classroom and take him out in the hall and have him do something as simple as jump up and down 10 times, which is vertical vestibular, because there's 3 canals of the 3 planes. Have him spin around to the right 5 times, jump up and down again, because that clears your head. And it's vertical vestibular, spin to the other side 5 times. So you wind up, you unwind, jump up and down. And on that last set of jumps, clap your hands at the same time. That's fine motor proprioception. That's why your hands tingle. And now he can go back in the classroom, and I promise you, not only will his posture be improved because you've activated all the core muscles, but that whole self-regulation, focus, and attention will allow him to start to perform whatever job he's supposed to be doing at the time. That's a quick fix, and it holds for about 30 minutes.
Okay.
Wow.
That's amazing.
That's amazing. Gosh. Wow.
The tricks in my bag.
That's so good, Melanne.
That
so
is
good.
amazing.
Yeah.
That's amazing. Gosh.
Wow.
Yeah. Okay.
So, one of the other things that I think it'd be good to, because we haven't got much time, but this is so good to talk about. Oh, we've got more questions there.
Katie's
Katie.
Katie's saying thank you.
Thank you. Okay.
Thank you, Katie.
My pleasure.
One of my grandchildren was diagnosed with hypermobility. Well, we're pretty sure has got hypermobility. And when he first started tripping over and falling over, and he was walking, and then suddenly he was crawling because he twisted or tripped. And we got really anxious. And I'm sure, Melanne, you work with a lot of families that when we're concerned about our children, this is major, and it's very, very hard to stay calm and to, remain positive at times. And thankfully with our little one, it was hypermobility, but for a bit we thought it could have been something else. Mm-hmm. And so what advice would you give to parents? What advice do you give to parents? And how do you manage that sort of anxiety that we can have around our children?
So every parent that comes to us has anxiety.
Right.
Often they've been a circuitous route of other specialists who, forgive me, don't know what they're doing. and they've just kind of said, well, I don't know, or they just kind of move them along. So by the time they get to us, their anxiety level is here. Mm. So just like you all, we do extensive assessments, all right, all standardized. But then I insist, before I give anybody a report, of sitting down with the parents and explaining to them what's going on. And the first message that I say to the parents is, again, I use this a lot. I need you to take a deep breath. We're going to go through this. And basically my message to them is, I need you to take my hand. I'm going to help you understand where your child got stuck, which system got stuck, and what we need to do to get this development moving forward.
Right.
We can fix this. Mm-hmm. Okay. Now, there are degrees of fix. Yeah. So is he going to play professional football? I don't know, but we're going to get him to be able to play football and enjoy the game, that kind of a thing. But I've been practicing for over 40 years.
Whoa.
I can count on one hand the number of children that made minimal progress in all of the countries that we work in. Wow. And mainly because a lot of information had been withheld that started to come out during the treatment and assessment process that led to situations where there was a lot more physical damage that needs a different therapeutic approach. We can do that, but a little different approach. But most of the children we work with that have a lot of the issues we're talking about tonight, they just got stuck. We don't know why they get stuck. The other message I tell parents is, this is not your fault. Mm-hmm. I do with hypermobility, Jackie. Look at the parents and say, okay, which one of you has hypermobility? Because sometimes it's genetic.
Hypermobility, I'm afraid.
Do you?
I think I'm slightly. I could always do things like back bends and the splits, and I'm so unsporty, and I wondered why I could do those sorts of things.
Well, the contortionists in the circus and the extreme shows, but it's interesting because there is a genetic predisposition, but we now know that there's a lot we can do to fix it. Unfortunately, particularly with hypermobility, and I know that's not what we're here to talk about, but there's a lot of misdirection in therapies. Like a lot of doctors will send them to physical therapy or physiotherapy. Let's strengthen the muscles on either side of those joints and make that joint more stable.
Yeah.
Again, they're treating an end issue instead of the foundational, which is why is there hypermobility? Well, it's because of low muscle tone. Why is there low muscle tone? Because of the vestibular system. So, because that's what regulates your muscle tone. So it's that simple, but you have to start to understand it.
That's so good. Thank you. We're going to come and see you, please. We got a question here. How can you help a child age 5 self-regulate when they are throwing objects and thus putting other children in danger without having to remove the other children?
Is it a parent or a teacher?
I think this is teacher.
A teacher. Okay. One of the most effective things, and I know a lot of teachers are uncomfortable about this, when you've got a child that's gone off, and we all know when they reach that level, I mean, the trick is to catch the early signs. Okay. But that's not easy to do in a classroom of 20 or 30 children. But when they've gone off, needs to be removed from the classroom. I keep yoga mats in all of my classrooms, because one of the best things to do, if you can, is to get them down and roll them up like a sausage roll and then sit on them. But the head is sticking out so they can breathe, And if you're not comfortable, just give them,
they can breathe, isn't it?
Give them deep pressure, or you have them upright and you roll them and you're giving them deep pressure hugs. If you're not comfortable, because this is deep proprioceptive input. Okay. And if, I know we're not talking about that tonight, you can look up proprioception. It has to do with little receptors in muscles and joints. But proprioception has a calming, focusing effect. If you're not comfortable with the sausage roll concept, you can also put your hands on little shoulders and push down. Okay. Pull them into your body and push down. And that deep compression, it goes all along the spinal cord, has a wonderful calming effect.
Wow.
Great. That's so good.
That's a
so
lovely
good.
answer.
Love it. Love it.
We have got another question about a child's, so this is from, I'm trying to pull this down, from Aina, but I think we might do that privately through you at the end, if that's okay, because it's autism and it could be a really complicated one.
So I think, Aina, we'd love it if you could email us and give us a little bit more information.
That'd be great.
And then we can email you back and we'll talk to Mel about that one. That would be great.
That sounds really good.
So should we just have time for one more question? Shall we do one more question?
Let's do one more question.
You've got one there.
Well, we've had this question, you kind of answered it. And we've got here, is there a link between physical activities and well-being in children? If so, can you talk to us more about it? There clearly is.
Oh my goodness. Okay, everybody, go get a glass of wine. We're going to talk for a while. No. All right. So, couple things you need to remember. Nothing is more important than movement.
Yes.
Movement stimulates most of these underlying sensory systems, especially the vestibular system, okay? Movement facilitates memory. So if you are trying to teach spelling or math facts or capitals or rivers in a country, so memory activities, sitting at the kitchen table in a chair or sitting in your desks in a classroom is the worst position you can be in. Either be on a ball that moves, if you've got mobile seating or access to it, get up and march around the kitchen table, when you're on a little walk, or go in a circle and be doing little steps while you're in the circle. Movement facilitates memory. Movement facilitates the language development. Okay, because of all of the stimulation that's going on. Movement develops our coordination skills, helps to develop core, and then extended gross and fine motor skills. It is the essence of our development.
Wow.
The issues we saw with little ones that were, and you don't see this as much anymore, but were in certain parts of the world where they were tied to their cribs in orphanages. And we would go in and look at the child for a parent that was wanting to adopt them. And, say that this is a deprivational delay. So it doesn't look like there's any sort of a organic or brain damage, but it looks like it's deprivation. They'll move very quickly. I view the pandemic as a deprivational situation.
Yeah.
So right now, I'm asking all of my teachers to bring movement back into your morning, midday, and afternoon routines. A little movement break takes 5 minutes. That jumping and clapping and spinning, I say to the teachers when they're losing posture and they're starting to hold their head in their hands or put their head down on their desk, or they're slumping, we should be sitting up straight. And they're starting to stare out the window and they're not paying attention.
Movement break.
Put your pencils down, everybody stand up right by your desk and do the jumping, spinning, clapping technique. And then watch what happens when they sit down. It's really a nice little thing. So yes, movement without taking too much time is key to almost every little bit of our functioning.
Including well-being.
Including well-being.
Well, emotionally, remember, movement stimulates the vestibular system, which is the one responsible for self-regulation.
Exactly.
And there's your whole emotional piece as well.
Wow.
Amazing.
And there's a book to be written, isn't there?
There is a book, Helen Garnett.
That's
great.
amazing.
I'll help you write it.
Thank you. That's so fascinating.
That is so good. Melanne, thank you so much. We really, really appreciate your time. And there was so much just gems in there. So thank you so much.
Well, thank you for including me. It was lovely to be here with you all. And I love what you're doing. And I love that you're giving a platform to put these messages out.
Great.
Well, I think there was almost more, we got more questions from the answers. I love this sort of webinar because there's so many more things that we can talk about as a result of this.
Let's do it again.
Let's do it again. Yes, please.
We'd love that.
That would be amazing. Thank you so much. All right. Well, look, goodbye, everyone. Have a wonderful Easter.
Happy
Enjoy
Easter.
yourself. Happy Easter to you. Enjoy a break and